Yeah, today I want to talk about how I got into treating peripheral neuropathy because I've had three types of neuropathies myself. Um, they say after you turn 40 everything starts falling apart. Well, now that I'm 42, I thought actually I was invincible until one day I started getting some carpal tunnel syndromes in my wrist. And all carpal tunnel is the nerves that run through your wrists and go to your hands and fingers. It gets compressed for some reason. A lot of times this happens from repetitive stress. For me, I like to work out in the gym, so I probably tweaked my wrist, causing the pain and the tingling in my hand, okay, and wrist. Um, Now, another type of neuropathy which I had was another weightlifting accident where I was in the gym doing this movement called the front squat, where you have the Olympic bar in your hand and you squat down. Well, the pressure of my bar, I probably had too much weight on. The bar was pushing into my fingertip, which caused numbness, tingling, and needle-like pains in my fingertip. Now, normally this stuff goes away, but it didn't. So what I did was I did the laser treatment on my wrist and my hand, and what happened was the pain and numbness and tingling went away. Now before, I couldn't even be able to type because just the pressure of typing, it would cause like these pins and needles like pulsing pains in my finger. But after combining a special type of electrical therapy and laser, it went away. Right now my wrist is a lot better. I'm combining with a technique called Graston, where we take these tools and we break up the scar tissue or any adhesions that might be building up in your wrist. And I've been combining that with the laser therapy, which has been helping, and now I have about 80–90% of the mobility back in my wrist. Another type of neuropathy which I had is the shingles virus. And what shingles is we've all had chicken pox when we were children, where you get those rashes all over your body and it's real itchy. It's actually a family of the herpes virus. And what happens is you build an immunity because after you get chicken pox, it doesn't come back. Well, it never really goes away because the chickenpox virus actually lives in a portion of your nerve called the dorsal ganglion. And when you get older, your immune system, when it gets weak, when you're a lot of stress, or as you get older and it gets weakened, you can get an attack of this chickenpox or herpes or shingles virus. And for me, it attacked my lumbar nerve right here, the L5S1 dorsal root ganglion, which is right here. And the virus actually follows wherever the nerve goes. So your L5S1 nerve here branches up from your low back, and there's a branch that goes down your glute all the way to your hamstring. There's branches down to the side of your leg and even into your groin. And just to prove to all of you I actually had this horrible disease, I'm going to actually show you the scars that formed after these blisters formed from this horrible shingles virus. So now, most of the time you go to the doctor and they make you, drop your drawers, right, to examine you or give you an injection in the butt. Well, here you get to see the doctor's butt, okay, because I want to show you what I had here. So I'm not shy, we're all adults, we're in the clinic. I'm going to show you what the shingles virus caused. So right here, it's my green underwear because I'm a Spartan, we're green and white. The virus started at L5S1. You can see those scars went all the way down my glutes, down the sciatic nerve, down the back of my thigh and the side, and also went down to my groin. Okay? So here you go. You get to see the doc's butt, but I really wanted to show you the shingles virus. Now, whenever you get shingles, you want to treat it as fast as you can. Okay? The reason why is you can get permanent nerve damage if you do not treat that shingles virus. Okay? As I've showed you, not only does it attack the nerve that the virus originates from, it also attacks all the branches from the nerves. So what happens is, you saw the scar tissue on my skin, but that scar tissue can also accumulate on the nerves. And if you don't treat that virus, what happens is you get permanent scarring of the nerve, which could cause permanent numbness, permanent pains, and permanent dysfunction and damage to that nerve. So what I did was I treated myself with a laser, and I took high doses of vitamin C to increase my immune system. And what that laser did, not only did it dry out all those blisters on my skin, it also eliminated the pain from the horrible shingles virus by melting the scar tissue off the path of the nerve. Okay? Now, a lot of people, when they get shingles, they don't know they have it because it appears as a rash. So it's important that if you have some type of pain or itching that doesn't go away with this rash, it could happen on your back. I've even had people come in, it goes to the back of their neck and ear. Get it treated right away. There are some medications which could, are antivirals, aceclovir, which can help decrease the intensity. But you really need to get that virus treated, get your immune system back in order, because again, it could cause permanent nerve damage and pains. Okay. Now, another form of peripheral neuropathy I had was actually recently, the past few weeks, off and on, I actually had numbness in my ankle and the outer part of my foot. Can you give me that ankle model right there? Okay. So I woke up one day and I had this numb and tingling pin-like sensation on my outer ankle and the outer part of my foot. Okay. Now, because it's only happening on one side, I theorize it's probably either coming from my back or some type of compression that is going around in there. Okay. Whenever I walked, it felt like, you know, there was like 1,000 needles just pulsating in my foot. So I knew I had to get this treated. And so I just lasered myself this morning on our high-powered 60-watt laser, and right now I can almost feel no numbness or tingling. There's a little there, but you know, I know this has worked. So whenever you have some type of disease or disorder or pain, you do a lot of research online on how to cure it. You become your own little expert. You go to Wikipedia online, you ask all your friends and colleagues, you ask all your doctors, relatives, and friends how to treat something, and you become the expert. Well, me, not only have I studied these nerve disorders in school, postgraduate seminars, because I've had it myself, I've done all the research and how to treat it because I had it, and when you have something, you want it to go away. And now that I know it's worked on me for these 3 or 4 types of neuropathies I personally had, and I have the confidence to say this laser treatment will work for most of you as well.